Honorable Foo Kune.
Thank you. Can I ask the Honorable Minister what were the criteria taken into consideration for the choice of the hotels converted as quarantine centers?
As I stated in my main reply, Mr. Speaker, sir, one of the problems we have had to face was that people had to share bathrooms and toilets. So these were among one of the criteria where rooms had annexed bathroom and toilets in the hotels. That's why we had chosen those hotels for quarantine centers, Mr. Speaker, sir.
B89.
Mr. Speaker, sir, our health institutions continue to dispense routine services during confinement period. As such, a number of patients, though little, attended their appointments as scheduled. Outpatients, irrespective of the nature of their illness or not on the appointment list, were seen by doctors at accident and emergency departments in our hospital and at various healthcare centers and mediclinics. On 18th May 2020, my ministry issued a circular to all hospitals to schedule appointments for all new cases first, and then for those who have missed their appointments due to confinement. I'm told that routine cases were attended at OPDs, clinics, and otherwise appointments were rescheduled. My ministry has already reprogrammed the appointments and the patients have been informed accordingly. It is expected that all the backlogs will be cleared by end of July 2020. From March 20 to 11th May 2020, 2,088 surgeries were effected, comprising of emergency cases, including routine cesarean sections, which were already scheduled. All cases not performed during COVID-19 are being scheduled, and new dates for operation have already been allotted. As from 11th to 29th May 2020, 796 emergency cases have been operated, and non-urgent surgical procedures have been reprogrammed. I'm also informed that as from 11th May to 31st May 2020, 784 routine cases have been attended to. As at date, I'm being informed that there are 3,367 cases awaiting surgeries in our 5 regional hospitals, including the cardiac center. I'm tabling a list of pending cases in each specialty.
Can I ask the Honorable Minister if he is considering to request the assistance of retired specialists and the private sector towards addressing the issue of backlog?
In the event that we have accumulated cases and it's getting too long to clear the backlog, this measure will be taken into consideration.
Can the Minister tell the House what are the criteria he will base himself on the choice of the doctors and the private sector?
It all depends upon the specialty where there is a shortage of doctors. That procedures, we will consider what are the specialties where operations are being delayed, and from that on, there would be a selection based upon advertisement, and then from the interview onwards, we are going to have the specialty depending upon the field concerned.
B90.
Mr. Speaker, sir, I'm informed that there is currently a stock of 1,384,400 hydroxychloroquine 200 milligram tablets at the Central Stores Department. With regard to Part A of the question, my ministry has purchased 1.8 million tablets in August 2019 at the cost of ₹1.57 per tablet. I'm informed that my ministry has, on 26 March 2020, awarded another contract for an amount of 2,538,000 for the procurement of 1.5 million tablets to be supplied in 2 equal installments. The first installment is expected to be delivered in 1 month's time, and the second consignment in 2 months' time. As regard to part B of the question, my ministry has received 502,200 tablets of hydroxychloroquine of 200 milligrams as donation from the government of India on 16th April 2020.
Honorable Kirin? No, excuse me. Honorable Foo Kune first.
Can the Honourable Minister tell us if for all patients of COVID-19 has hydroxychloroquine been used in a non-discriminative way, irrespective of age and underlying conditions?
Yes, but this question is not pertaining to the question that has been asked. But yet, yes, so far my information I have that all patients have been receiving chloroquine tablets till lastly when we have another advice from World Health Organization.